the world, actually. This webinar is free, and we hope you will show your support and join USSAAC by going to www.ussac.org/membership. Our new membership year begins January 1st, 2016. A quick disclosure: as your facilitator, I have no financial or non-financial relationships to disclose. Now, let's quickly cover some logistics. Number one, your microphone will be muted throughout. You can ask questions by typing into the question box, which is in the lower right-hand corner of your screen. Questions will be answered as time allows in the last segment of the webinar. And we may group some questions together that are similar. We ask that you pose your questions in a general fashion rather than related to any specific individual. Also, questions that are not responded to during the webinar may be answered afterwards through email. Number two, ASHA continuing education is being offered. The ASHA CEU participant form and certificate of attendance can be found at the website that you're going to receive in your email after the webinar completes. You must stay for the duration of the webinar in order to receive credit. And just so you know, our webinar platform lets us see who is on and for how long. So directions for submitting the completed form are also on the site. As I mentioned, all registrants are going to receive a follow-up email that provides the link to the site, the slides on this webinar and other USSAAC webinars, the CEU form and instructions, and also an evaluation survey we'd like you to fill out. This webinar will be archived within a few days so that both the audio and the slides will be available. Please note that we are unable to offer CEUs except during the live broadcast. Learning objectives. What will you learn? Participants will learn about communication access as a social justice issue within human rights legislation, implications for policymakers and legislators, businesses, organizations, and the AAC community, an ongoing Canadian strategy to promote awareness of communication access, and available resources and networking opportunities. This is going to be the first of at least a two-part series. In 2016, USSAAC plans to offer 4 additional webinars, and this would be one of those. One of these would relate to this topic. Now, I'd like to introduce our speaker, Barbara Collier. She is the Executive Director of Communication Disabilities Access Canada, CDAC, a national nonprofit organization that promotes social justice, accessibility, and inclusion for people who have communication disabilities. She's a speech-language pathologist and an ISAC Fellow. Among her many advocacy activities over the years, she is now managing what's called Communication Access Now, a Canadian-wide strategy that promotes accessibility and awareness of accessibility requirements for people who have communication disabilities. So thank you very much, Barbara, and off you go. I know you have a lot to share.
I do. Thank you very much, Sarah. I hope everyone can hear me. I can't see anyone. I can just see my slides. I hate talking to a computer, so please forgive me if I tend to ramble. It's an honor to be talking with you this evening about one of my favorite topics. I know I have a lot to say. I'm going to try and give you an overview of the topic, and as Sarah says, hopefully there will be other webinars that we can follow up with. Before I start, I want to just tell you a little bit about my organization, which is called Communication Disabilities Access Canada. We're a non-profit organization. We've been around for, 14 years, going on 15 years. We have, our focus, as Sarah said, is promoting human rights, accessibility, and inclusion. I tend to use those terms rather than advocacy. We don't do advocacy. It's far too soft for us. But we are promoting human rights for people who have speech and language disabilities, and that includes people who use augmentative and alternative communication. So it's very important for you to know that we are talking about everyone here. And there's a reason that I use the term speech and language disabilities, and that is because in the world of accessibility and legislators and policymakers, when I say communication disability, they think hearing loss, they think intellectual disability, they think sign language and braille, and of course that's not what we're talking about here. We're talking about people who have speech and language disabilities not caused by a hearing loss. The reason it's important to know a little bit about our organization is that we're teeny tiny. We do not have any real estate. I work from home. I work only when we have a project that funds us. And we have had some very good projects over the years. But they're all time-limited projects. So we have a lot bigger ideas. We would love to do more, but very often we are restricted by our funding and by our projects. We're quite unique in that we're not a group of speech pathologists and AAC clinicians trying to be lawyers. We are a hodgepodge. We have speech language pathologists, AAC clinicians. All of our projects involve legal professionals, accessibility consultants, and by all means people who have speech and language disabilities, many of whom use AAC, and they are all paid consultants on our projects. We have done projects since 2001, and they're all linked in some way to accessibility and to social justice. Projects on abuse, on safety, on leadership, and our current projects, access to justice, and as Sarah said, communication access now. So we've got a lot of things going on, and I'll be telling you about a few of them. But please take some time to visit our website for some of our other projects. Sarah said what we're going to be talking about. I hope this is the same, Sarah. I'm going to be covering the legal context for communication access rights, and I'm not going to do that in any detail. There just isn't enough time for that. But I'm going to give you some sense of what's going on, and I'm going to focus then on the key messaging and findings from a Canadian project that I'm managing called Communication Access Now. And we're focusing on the messages for policymakers and legislators, businesses and organizations, and people with speech and language disability, including people who use AAC. And I want to leave you with some resources. Basically, this webinar is to start the conversation. So the legal context, basically, it's as simple as many countries have laws that protect the rights of people who have disabilities to get equal access to goods and services in their communities. And those laws can take different focuses. So you've got anti-discrimination laws, you've got accessibility laws, and you've got human rights laws. In the US, you all know that you have the Americans with Disabilities Act, very strong legislation. Other countries have ratified the UN Convention on the Rights of Persons with Disabilities. I think there's about 180 signatories on the convention at this time, and that legislation basically sets out principles for human rights and accessibility, but it needs to be rolled out domestically. So for instance, in Canada, Canada has ratified the UN Convention. I don't believe the US has done that, but Canada has ratified it, and that means that they're obligated now to put into place legislation around accessibility and human rights. I need to take a little bit of water. I hope I'm not going to glug glug. So that's what's happening here. And the legislation that's rolling out in Canada is happening on a provincial level. So we've got provinces, like you have states in the US, and each province is looking after its own legislation. There is a movement right now to come up with a Canadian Disability Act. So that's the context that we're talking about here. And these laws, they tell businesses and organizations what they must do in order to make their goods and services accessible to everyone. So that's the focus of this. I'm not going to go into all the legislation, but I think it's important for you to know that in Ontario, where I am, in Toronto, Ontario has legislation that's a bit different from the American Disability Act and other places. That legislation is all around making services accessible. And what it involves is mandatory training on accessibility for people who interact with the public in private, public, non-profit sectors. So that's actually mandatory in Ontario. I think it's the only place in the world that has that. Now, you know, I'm not getting into the quality of the training. I'm just saying that that's in place. The other thing that's happening here is that, again, businesses and organizations must have accessibility policies and procedures in place that address the barriers and really spell out the accommodations that need to be put in place for people with disabilities. We also have mandatory reporting to the government on this and a complaint process that's in place. So people can actually complain to the Accessibility Directors of Ontario saying that this particular business or hospital or whatever it is not in compliance. It didn't make their services accessible. This is not at all perfect. Major issues around enforcement, major issues in a number of areas, but it's a really good start. And the reason that it's important for us is that here in Canada it is seen as the gold standard for the other provinces. So we're seeing maybe, like we just saw Manitoba coming in with its legislation very similar to what's going on in Ontario, and the other provinces are going to be the same. So here's what I think right now around the legislation. There's no doubt that many people with disabilities are benefiting, particularly for that awareness training that is mandatory and the policies and procedures that must be in place. There's a much greater awareness of curb cuts, about who and when, who needs sign language and the obligations on businesses and services to provide that, a greater understanding of Braille for people who have visual impairments. And that's coming from the specific regulations and guidelines. Now, we reviewed, as part of our project, we just recently reviewed seven government documents from different provinces across Canada. And this is not going to surprise any of you. We found that the major focus is on mobility and sensory disabilities. And we counted on our fingers how many references in these documents relate to people with mobility disabilities and a public space accessibility. And there were 330. And looking then at sensory disabilities, people with hearing loss, with visual disabilities, we found 281 references. And just keep that in mind now when we talk about people with speech and language disabilities. Remember, I use that term because communication is seen differently within the accessibility world. So the question then is, with all this going on, are people with speech and language disabilities benefiting from accessibility legislation in the same way as people with mobility and sensory disabilities? And and I would say no. Quite simply, I would say no. We found all of 7 references to, it wasn't even speech and language. Language was never mentioned. We found 7 references to speech disability. And that was even at a stretch where we would say, well, are they really talking about our population here and the needs of this population? Or they might mention that somebody's speech might be unclear, or somebody might use a display, and that was it. So not in any way that we could see being translated to improved accessibility for people with speech and language disabilities. What we are seeing, and again, I don't think this is going to surprise anyone, or I don't think it's unique to the accessibility legislation that is rolling out in Canada and in Ontario. We're seeing that communication is about alternate formats and about accessible websites. Alternate formats being mainly directed around accessibility for people with visual disabilities, and accessible websites. We're also seeing that communication tends to be rolled into or seen as a sensory disability or as an intellectual disability. We're seeing that communication is perceived as respect and attitudes, and that it's about the language of disability. It's about people first language that we're all familiar with. It's about talking directly to somebody, and there's nothing wrong with that. That's wonderful. However, we believe that communication access for people with speech and language disabilities is much more than having a good attitude and being nice to people. So we want to see it going much further than that. But that's where it tends to sit in a lot of these documents and a lot of the thinking that goes behind them. And what we're finding as well is that there are no obligations for what businesses and organizations need to do in order to make their services accessible for people with speech and language disabilities. There are very clear obligations about providing sign language. There's very clear obligations about putting ramps and door openers in. But there seems to be nothing about what an organization needs to do when the customer, the patient, the client, the victim, the accused happens to have a speech and language disability. And the other thing that I thought was not surprising, but shocking at the same time, is that there was no representation of people with speech and language disabilities on any of the committees, the accessibility advisory committees that were involved in producing those 7 different documents across Canada. Just no representation. And that can be a person with a speech and language disability or a speech language pathologist or an AAC clinician or a family member. We're saying no representation. And that's very, very unusual because all of the other disability groups are very active on the accessibility advisory committees, and that's one of the specifications from the UN Convention, that none of these laws and legislations and regulations should be developed without consultation with people with disabilities. Why is this sadness happening that we're just not being represented? And I think, I could talk for a long time about this, but I'm not going to. Very simply, I think we're not at the table. And even those of us who are at the table, and trust me, I was at the table for the Ontario legislation that for a number of years, sticking my hand up every second saying, but what about, and would you consider this? When it came to it, we weren't listened to. It just was too foreign. for many people to get their heads around. And they really wanted to hear from people with disabilities. The professional speaking on behalf of people with disabilities is not as powerful as that. So it's true, we're not at the table. I also think that the issue is that we tend to, as a sector, we tend to be somewhat siloed, or very siloed, let's not say somewhat. We're in the AAC field, we're in aphasia, we're in autism, we're in developmental services, cognitive disability. And I think what tends to happen is that each of these groups really advocates for awareness for their population about aphasia, about AAC, whereas really what we need to be doing here is representing people who have speech and language disabilities, regardless of how they communicate and what their diagnosis is. So I think it's much, much bigger than the AAC field, and we need to come together, and that's been one of the challenges. There was no consensus on what we want. And I think that's very true. When I sat on the Accessibility Committee some years ago, I had no research. I didn't have enough to back me when talking about what access means for this population. And I think we're still working through some of those things. We have to have that conversation. A lot of people, a lot of practitioners feel that this is outside their scope of practice. That's a reality. People are very busy. People are working in clinic rooms. They've got clinical practices. Are we expecting people to now work on human rights? I believe that we have to be there, or somebody has to be there, or we need to have representation there. And I think it's true to say that the loudest voices are heard at these meetings. We are starting off this process, and when you consider what the Hearing Society, what the Canadian National Institute for the Blind, all of these different organizations, they've been around for a long time, and they've been very involved with the disability movement. They know what they want. They are very clear about what they want. So this is not just about really knowing what we want. We also need to be able to articulate it in a way that can be interpreted within a legal framework. All of this was a huge challenge for me personally when I started to work in this field, and it still is a challenge. Why should we care? Why are we listening to this and doing this work? I really believe that many of the barriers for people with speech and language disabilities are caused by service providers and by lack of accommodations. All we have to do is sit at a town hall meeting at ISAAC or any other conference and listen to our clients, listen carefully, and there's only so much they can do because many of their barriers are caused by the business, the organization that they are interacting with, by the fact that these sectors are non-responsive to the needs of people with speech and language disabilities. Not all, I'm just saying generally. I believe that legislation can increase access by giving clear directives. I don't think that access is going to just happen. I think that we need to be driving it. We need to have the legislation behind us, and we need to tell the legislators what we want that will make a difference. I also believe this is an enormous opportunity for us to be part of a bigger disability human rights movement. It's been going on for years, and I don't see a lot of people who use augmentative communication or who have speech and language disability at the public consultations that I go to or at the accessibility advisories. So it is an opportunity if we are ready, willing, and able to participate at them. So that brings me now to tell you a little bit about what we're doing in Canada. We have a Communication Access Now project. It grew out of an earlier project that we did in 2010, and that was, we researched what communication access meant for people who had speech and language disabilities. So for everyone, what were the generic features of communication access? I'm very aware that access needs to be individualized and everybody is different, but we're talking about the generalities here. We did publish that. It's in the AAC Journal 2012. I think I got a reference on your handout for that. And that was, and Sarah Blackstone, Andrew Taylor and myself did that. From that, we decided there was a need to do a national awareness, again, awareness seems to be very soft, strategy to promote communication access for this population. And it was a 3-year project. We're funded by the federal government, so we can go across the different provinces in Canada. There's a team working with me. We have 4 coordinators working in BC, in Alberta, Ontario, Atlantic Canada. We have social media coordinator who puts out everything on Facebook and Twitter. It's very active, and we have a lot of resources on our website. I am not going to be able to talk a lot about our resources this evening, but I hope that I will inspire you to go and look at them very quickly. We have a communication access symbol. We did some research. We developed it. We're hanging a lot of our work on it. We have had committees looking at barriers for different sectors, so for voting, for transportation, as well as healthcare, for emergency services, for justice, for a legal meeting, all of the different sectors. We have toolkits on there for people with speech and language disabilities, for clinicians, for advocates. We have an e-learning, 8 e-learning modules for businesses and organizations that want to become more accessible. Tons of brochures and booklets, social media, and we also have links to other resources, and I want to make sure that you know we're not the only ones doing work in this area. Lovely work coming out of Australia, the Scope Group, lovely work coming out of Scotland as well, and the UK. So we've given you some of those resources as well. And that's a picture of our site, and that's our site. And you can go on and check it afterwards. So, what is communication access? Let's start on the same page here. Now, I don't say communication bill of rights. I say a communication access bill of rights, or I talk about communication access rights. My belief is that we all have the same communication rights. However, the issue here is accessibility rights. So that's the framework that we're working on here. And this came out of the research that we published in 2012. Communication access means understanding. It came from the survey. So understanding what others are saying. Remember, it's going to have to be comprehension as well as expression to include everyone. It's about having other people understand our messages. It's about having time and opportunities to communicate. It's about using our preferred methods of communication. It's being able to communicate in face-to-face interactions, over the telephone, at meetings and public events. It's about being able to access reading materials, be they on the web or in hard copy or a brochure. Being able to sign documents, take notes, I forgot that one, and complete forms. That is what we are talking about when we talk about communication access. And it sounds simple, and in many cases it is simple. depending on the person with a speech and language disability, depending on the business and the organization and how well they know them and all the rest. It can be very, very simple, and it can be amazingly complex when you're talking about when you're talking about essential services where communication is critical. I want to focus now on what do we want, the messages. As I say, we have, I could spend the whole day or week talking about the resources and all of the rest, but I want to focus in right now on what are we trying to do here? What are we saying to people? And this is my evolution in thinking, and it keeps changing as I go through this process, but here it is. It's a snapshot for now. So what we want to do is we want to improve access to goods and services for all people with speech and language disabilities. And that's our symbol there. We want to do that by having strong messages reflected by legislators and policymakers, by businesses and organizations within their practices. We want to have good practices in essential services, and we also want to educate people who have speech and language disabilities, not only educate them about their accessibility rights, but assist them in negotiating their accessibility rights, because they're absolutely key in this. So first of all, starting with legislation and policymakers. This is what we would like to see. We'd like to see communication as a disability domain. By that I mean mobility is a domain. Nobody goes up to somebody who's in a wheelchair and says, what's your disability? The issue is that they need access, they need a ramp into your building. We want to also see communication dealt with as a full domain that includes people with speech and language disabilities not caused by hearing loss, because right now it only includes people who have sensory disabilities or intellectual disabilities. And what my experience is that this is the only issue, communication, speech and language tends to be discussed from a diagnostic perspective. And for example, I was at a workshop recently for police, and the police, it was about accessibility. And what the police had done was to bring in experts, professionals from different fields. So they brought in people who knew autism, who could tell them everything about autism, people who knew aphasia, people who knew intellectual disability, and people who knew cerebral palsy. And I feel that this is going the wrong way, because nobody comes up to somebody and says, and we know this, oh, you must have autism. Well, I just happen to have 3 or 4 things that I know what to do. That's just not the way we want that to happen. And we've seen this happen from other groups. We've seen, I've seen a video where a man goes in, there's a receptionist, it's a leisure center, and he doesn't understand what the woman is saying, the receptionist is saying, he gets very irate, and she goes, oh, you must be deaf, and pulls out an iPad. This is not what we want to happen. We don't want people to guess disabilities, and we don't want people to guess what to do beyond the approach to the person. It is up to the individual then to tell people how to make their services and their communication accessible to them. I'll tell you a little bit more about that. We want people to approach people in a respectful way with no preconceived ideas of their disability, and to recognize that they're the ones who will lead it from here, which means, of course, that we have to educate people with speech and language disabilities as well. We also want to see communication across all regulations. Right now, we see laws coming out about employment, about transportation, about information, about customer service, and we believe that communication crosses all of those regulations. We would very much like that communication includes people with sensory, so hearing loss, deaf and deafblind, and people with speech and language disabilities, so that there is one approach. But that's not how it's rolling out right now. We want communication to include comprehension and expression. So accommodations are about effective two-way communication, and that includes both comprehension and expression. Most of the work that's being done, most of the documents that I'm reading really talk about getting information into someone's head. Very, very few talk about understanding what somebody is saying to them. And we see even fewer references to face-to-face interactions, apart from respect. Very little on telephone communication. When a business does a lot of their services, like governments do a lot of services through their telephones. So what happens if you can't communicate? Can you use a communication assistant? We say yes. All of that needs to be looked at. Meetings and public events. We want, and we've been somewhat, well, a little bit successful in having communication assistance on an agenda or on a checklist for people's accommodations for public events and meetings. And we really, really want this to happen. Same thing for workshop. If I give a workshop here, I must accommodate somebody who needs captioning or sign language. And we want to be able to say there are people who may need communication assistance, and they should be able to access those public meetings and be able to request an assistant in the same way as they can request an attendant. We also want to see written communication on the agenda, or to be included as within the domains. We want to see communication access directives for sectors where communication is absolutely critical. We're talking about healthcare, emergency, government services, education, police, legal, justice services, and others. And within those, we want increased training. There is such a difference between the coffee shop and the local library versus these sectors. These sectors, we need to raise the bar. So we want them to have much more training, specific training. We want them to have communication barriers, policies and procedures specifically for this population. And we also want to see a directive that says communication assistance, and we have intermediaries here. We're starting to train intermediaries to write those services in, those support services, people who can assist people communicate in key or critical communication contexts, such as a legal situation or communicating with police, or a consent capacity case in healthcare. And our message to legislators and policymakers is include us. Have representation on your committees and engagement at public consultations of people with speech and language disabilities, their family members, and communication disability professionals. That's just like, it gives you an overview of what we're messaging to the policymakers. Here's what we're saying for generic accessibility services. We're talking about the coffee shops here, the libraries, community businesses. What we want them to do, and this is in keeping with what's rolling out across Canada, we want, as part of their training, well, we want to have staff that interact with the public, trained in how to communicate with people with speech and language disabilities. So to go beyond being nice to people and using correct language, but what happens, what should you do if the person has difficulty understanding what you're saying, or if the person, or you're having difficulty understanding what they're saying? And so our messaging is quite simple. We can't expect the world here, but we can talk about talking directly to the person, following the person's instructions. And here's where it is key that we start empowering people with speech and language disabilities and letting them know that there is going to be an expectation that they show a card or a program into their device what they want the person to do in order to make their services accessible. And that will be different whether it's a hospital or a coffee shop. This is going a bit beyond the communication passports, which is about this is what I do. What we're talking about here is this is what you need to do in order to make your services accessible. And again, lots of stuff on our website. There's tips on how to develop a communication card. You can download the card as well. Giving more time for communication. Right now we direct all businesses and organizations that will listen to us to our e-learning modules. And the e-learning modules are on our website. There are 8 of them. I don't think I can remember them all, but there's background information. There's a module on how to talk to somebody who may have difficulty understanding you, how to talk to somebody who communicates with unclear speech, who communicates using a display, who communicates using a device or an assistant, how to communicate with somebody over the telephone, how to make reading materials accessible, how to make public meetings accessible and conferences and workshops, and how to make written communication accessible. It's very broad brush strokes. We've had a really good feedback from these modules, and people get a certificate of attendance when they do the first 4, and then they're the basic ones. And then if you're a receptionist that answers the phone, we encourage you to do the telephone one or to do whatever suits your job description. We also ask businesses and organizations to display the symbol as a sign of awareness and welcome. We do not use our symbol to accredit. That's just beyond the capabilities of the project. It also wouldn't work in Canada without an awful lot of funding behind it. And we're also finding that there are the bureaucracy here is that it needs to go to head office, it needs to be signed off, and there's the possibility of, if somebody comes in, they might sue us if we didn't understand what they communicated or whatever. People are very leery about that. We are much more simple. We say, show it to welcome, and it's being used quite extensively for that. Essential services. We want policies and practices to ensure effective communication access in sectors that are significant for people with speech and language disabilities. Going back to our research, the research that I did with Sarah in 2010-11, people with speech and language disabilities told us that all sectors needed to be improved. But they also said, here are the ones that need to really improve. These are the significant ones. And it's interesting to note that apart from transportation, none of the other ones have actually been addressed in the legislation in Canada so far. It's very generic, but transportation, employment, the other ones then are information and communication and public spaces. We want specific directives here. The reason that some of these, so for instance, government services, these are essential for people with speech and language disabilities, particularly around social assistance. And they're telling us that many of their problems are around completing forms as well as communicating over the phone with government representatives around social assistance issues and other, like funding for the wheelchair, the communication device, whatever. In fact, I know somebody who was actually told that she needs to make her mother, or a power of attorney, to have a power of attorney in order to allow her mother to assist her communicating over the phone with them. And this person has a master's degree and works in a university. So Clearly, these are things that can be discussed and worked on, and that's what we're doing in this project. We're meeting with these various government groups and trying to come up with policies where people can use communication assistance. Other examples, healthcare. Communicating about healthcare to healthcare professionals, major barriers there, highlighted very much by Sarah and her group and her website, Patient Provider Communication. We're also seeing huge barriers around informed consent for people with speech and language disabilities. We have situations where people have been giving their consent or not, not giving their consent and being ignored, and families being asked for that. We have situations where doctors are advising families what to do. I mean, it's very scary what's going on here, and this is access. To me, this is accessible communication in these contexts. End-of-life directives, and even just starting to think about, in Canada now we have regulations being developed around doctor-assisted suicide. So we want to make sure that people with speech and language disabilities are protected, are safeguarded, and that their messages are accurate and authentic in these situations. People with speech and language disabilities also told us that disability services actually needed to improve. Rehab centres, attendance services, wheelchair vendors, transportation. If we look at the transportation regulation here, it's all about getting places. People with speech and language disabilities are saying it's about booking, it's about communicating with the driver, it's about safety issues, telling the driver how to tie down the wheelchair, what to do with a communication device during a ride. It's about emergency services. It's about police, legal and justice services, making disclosures, giving testimony and legal meetings. That's where we need to be going. And in essential services, we really have to look at much more training for frontline staff, accredited training. We need to have a process that assists these organizations to recognize their barriers and the required accommodations. I can tell you from all my work, and I've been doing this for 14, 15 years, they don't know the barriers. In many cases, they're not even aware of the population. There's an assumption that somebody's with them, will always be there speaking for them, they speak with one voice and all of that, and they're not even thinking about the barriers for this group. And we cannot come in and preach the solutions until they recognize that there are issues. We also need these services, some of the services, particularly emergencies in healthcare, to have some basic tools. So we're talking about some communication displays in these contexts. I really believe that in other situations, it is the responsibility of the person with a speech and language disability to have a method of communication, and it's our responsibilities as clinicians to give them displays and vocabulary in their systems so that they can communicate. It is, I don't believe that we should be expecting taxi drivers or bus drivers to whip out communication displays. I don't think that's going to realistically work, and I think that where there are rights, there are also responsibilities on both sides. We also want essential services to know when and how to use communication intermediaries, and that's coming from 98% of people who use AAC said they wanted communication assistance in critical situations, and 40% said they may not have anyone to assist them, and that was from our research, which I quoted before. What we have been doing, and you can get this on our website and be happy to talk about it another time, we have been training speech-language pathologists to work as intermediaries in legal situations and in justice situations. What we do need now is a directive from accessibility legislation, really obligating justice professionals and police to access this service. I mentioned that there is work happening. I want to make sure you've got that wonderful work, patient-provider communication. I've given you the reference at the end. Also, Sarah's work with emergency services on the RERC side. The work that we're doing with justice, and we're currently just started a new project on communication access in legal decision-making contexts. And we're dealing with healthcare, financial supported housing. And if you go on our Facebook, there is a link to a survey, and we would love we're looking for stories. Again, we have to talk about the issues if we're ever going to be listened to when we talk about solutions. I'm aware of the time, and I'm almost there. But this is so important. People with speech and language disabilities and their families, you know, we can preach forever. Nothing will change, guaranteed, until people with speech and language disabilities and family members cross the threshold to that service, know their rights, their communication access, know their roles and the responsibilities, and know what they can expect from people, but also bring with them the communication methods or supports, or well, not bring with them the supports they may need to have access to, but their communication methods. They must know about their individual accommodations, not just here is the rights and here's that, but they must be able to say, look, it takes me longer to communicate. I need 15 minutes extra for my doctor's appointment. That's an accommodation. That's not just being nice. That's an actual accommodation for speed. And there are ways around that. You can ask for an appointment at the end of the day. You may say, well, I need a communication assistant. That will make things go a bit more smoothly. Knowing the right to have a communication assistant and an intermediary in certain situations, so that, for instance, communicating with the police or in justice, saying, I need somebody, I don't have somebody, and that's up to the essential service to provide that. So really educating people, and we have the toolkit on our website around their own rights and how to negotiate them. This is a very high-level language skills. It's about recognizing what your rights are, but when they're not being met, and then having the skills to negotiate and the language to negotiate it. We do have communication vocabulary, displays, pictures and words that can be downloaded for that. And then, of course, the next level. How do we mobilize people with speech and language disabilities and involve them in the political process, to be involved in the accessibility committees themselves, to know the legal framework that is being discussed, and I say it is a different world, to know exactly what the needs are, but not only to represent personal needs, but to be able to represent the needs of all people with speech and language disabilities. And for that, I always say there's probably going to be a need for two people from this sector on accessibility advisory committees, one a professional and one somebody who has personal experience. This is an example of something that's on our online toolkit. It's a communication access card. We ask people to just download them, print them off, and fill them in at the back. Summary. I'm there, Sarah. I know you've got things to say and there's questions. I have to say that the progress is very, very slow. I've been doing this for 14-something years. It is very slow. People are not knocking on the door saying, oh, we want to include people with speech and language disabilities. Tell us how to do that. That is not what's happening. We are begging for meetings with accessibility advisory committees and with government groups to be heard. But when they do hear us, they are beginning to listen. I'm being modest now. They are beginning to listen. It's going to take an awful lot longer than 3 years to do this. We're currently working with legal professionals to explore ways to strengthen the legislation to help us articulate things a bit more strongly for that context. We absolutely see the need for engagement of everyone. People with speech and language, families and service providers. We're doing trainings for ambassadors. We have ambassadors who, from those different groups, to get on board with this, because this is going to be long term. And we're moving now towards trying to find funding and projects to start looking at customizing legislation within essential service. Our project ends March 2016. We will not end. The CAN project, well, CDAC hopefully will continue with other things. I have given you resources. I'm now going to stop and turn it over to Sarah for questions.
Thank you, Barbara. We're just going to do a couple of questions. One of the questions that came on early was regarding terminology, and with the client group that you're talking about, and the difference between, or the rationale for using communication disabilities, or I think actually you say speech and language disabilities rather than complex communication needs. Want to comment on that?
Yes, I will. We're not talking about complex communication needs. We're actually talking about everybody. And I think complex, personally, I think it's a subjective term. And I don't know who's complex and who's not complex. The reason we don't use the word communication, and you'll find that I do. I go back and forth. It depends who I'm speaking to. If I am speaking with policymakers or with businesses and organizations and government group, they get it when I say speech and language disability not caused by hearing loss. If I say communication disability, they immediately think hearing loss, intellectual, and braille and sign language. And if you look at, a case in point is to look at the regulations in Canada for information and communications. It is all about getting information into somebody's head. It is not about expressive communication. It does not deal with face-to-face. It does not deal with telephone. So I find that I get further if I say speech and language disabilities. Of course, yes, we can pick away at that. People who have speech disabilities do not necessarily have language disabilities. I understand that. I've said speech and language disabilities for simplistic, but in truth it should be speech and or language disabilities.
All right, another very quick question, because we are running out of time, is can we use your symbol, and how would we get access to that?
Absolutely. Anybody is welcome to use our symbol. Our symbol is not trademarked. It is for promotion, and we just added some of you may know an earlier version that didn't have any ears. We have added ears to it, so it's an evolving piece of art. You can download it from our website under resources. You will see the symbol. You'll also see, you can download it as stickers, like envelope stickers. You can also, there is a desktop symbol which says, let us know if you need any assistance with communicating with us, or something like that. And people are putting that on their desks.
Wonderful. We have one comment, and then we're going to have to close this down. This is from the mother of a son who has speech and language disabilities, and she says, thank you for your talk, and she's going to have a look at the resources and then ask her questions. And anyone else who has questions, I assume they can email you, and you can respond then. Is that right?
Absolutely, and I'd really encourage people to follow our Facebook. Glenda Watson-Hyde does a wonderful job on Facebook and Twitter, and we're such a small organization that when we have a thought or a resource, we can't always put it on the website, but we do try and keep everything updated on Facebook, and we would love more action. We'd love to hear from you.
That's great. Okay, so we're going to conclude on time. Thank you, Barbara, for this informative hour. There's so much to think about, and USSAAC is, I can tell you, going to be thinking about this. Thanks to all of you for your participation this evening. Please complete the evaluation that you'll find when you just click on the email you're going to be receiving. You're going to find slides, you're going to find the CEU forms, and as well as other USSAAC webinars that are archived there. These archived webinars, most of them are captioned, and we do try to include the transcript or the captioning with each webinar. We're planning to do at least 4 webinars in 2016. So please fill out the evaluation form as well. We're particularly interested in your suggestions for future topics. And please join USSAAC. They'll continue to be free for USSAAC and ISAAC members in 2016. Also, save the date. There's an upcoming ISAAC conference in Toronto that in 2016, beginning August 6th, ending on the 13th. And I want to thank you all. Till next time, thank you so much.